What is obsessive compulsive disorder, often known as OCD? Obsessive compulsive disorder is when someone has repetitive obsessive thoughts, actions, and behaviours. In other words, they may focus on something very, very particular and keep going back to that. For instance, like closing a door. They may go to close a door 10, 20, 30 times. It's closed and they're happy it's closed, but they close it again just to make sure it's closed. Often people with OCD can have cleaning obsessions as well, cleaning something several times, what's called checking. Now, OCD isn't all bad, because many successful people are obsessive compulsive. In other words, they've learned to do something really exquisitely, and they do it repeatedly, and that makes them successful. But when obsessive compulsive disorder makes it so you can't function in ordinary everyday life, then you need some help. And you can be helped through cognitive behavioural therapy and through behavioural training and hypnosis. And it's a really important thing if you're suffering from OCD, that you seek the help of psychological and psychotherapeutic therapists and not just take drugs. Because often people who take drugs for OCD, the drugs seem to become less effective as time goes on and the person can be back to where they were. So you can have help. Here's a tip. You need to be obsessive about getting help, as obsessive about getting help as you are about whatever you're obsessed about. That's a really good tip, because when I've seen people do that, they've done very well in therapy. Take care for now. See you later.